All right, let's talk about what it really takes to pass one of the most demanding exams in all of medicine. We're going to break down how to prepare for the surgery finals, a true trial by fire for any doctor in training.
So let me just ask you straight up. Do you think you could pass one of medicine's toughest exams? It's a journey that tests way more than just book smarts. We're talking endurance, skill, and pure nerve. Let's dive in and see what it's all about. But before we even get into the nitty-gritty of the exams, we have to start at the beginning. We need to understand the foundation. I mean, why is surgery such a massive deal in a doctor's education anyway?
Well, here's the thing. Surgery isn't just for surgeons. You might be thinking, hey, I don't want to do surgery. But it's a core subject for a reason. Its principles, understanding anatomy, how diseases work, how to care for a patient, that's essential for everyone, whether you end up in general practice or some super-focused specialty. It's all connected.
Okay, now for the main event. Let's talk about the exams themselves. It's time to face the enemy and break down this absolute beast of an intellectual challenge that every single medical student has to get through.
The sheer amount of information you need to know is just wow. It's staggering. The written part is split into two huge papers. Paper 1 hits you with general surgery and applied sciences, then throws in specialties like pediatric and cardiothoracic surgery. And paper 2, you've got gastrointestinal, endocrine, orthopedics, anesthesiology, even ethics and communication. Seriously, the list just goes on and on and on.
So how do they test all this? Well, here's paper 1. It's a 3-hour marathon. You've got long, structured questions, complex case scenarios, short notes, and of course, multiple choice questions. And look at how the marks are broken down. Every single section is designed to poke and prod a different part of your brain. There is absolutely nowhere to hide. You have to know your stuff inside and out.
And just when you think you can finally catch your breath, bam! You got to do it all over again. Paper 2 follows the exact same brutal format. Another 3 hours, another 100 marks on the line. The academic pressure is just, well, it's immense.
But believe it or not, the written exams are only half the battle. Then comes the practical exam, which is a completely different beast. This is where your theory gets put to the ultimate test, in real time. You're dealing with live cases, getting grilled in oral exams, identifying instruments on the fly, demonstrating procedures, interpreting scans, all while your examiners are watching your every move. No pressure, right?
So you're probably asking, how on earth do you prepare for that? The answer is you get out there on the front lines. It all happens during what's called clinical posting. This is where the textbook pages collide with real life.
Life in clinical posting is total immersion. It's not a classroom anymore. You're on ward rounds, you're in outpatient clinics, and you're getting that crucial exposure inside the operating theater. A huge part of the learning comes from preparing and presenting detailed cases on actual patients.
And of course, you've got this classic dynamic, right? The teachers want discipline, respect, and a real hunger to learn. The students, well, let's be honest, sometimes they're just hoping for a little freedom, maybe a movie, and definitely less studying. It's a timeless struggle.
Okay, but all jokes aside, the reality is incredibly demanding. The bottom line is this: active participation, strict punctuality, and consistent, top-notch case presentations are completely non-negotiable. This is where you forge your professionalism.
All of this intense, on-the-ground training is designed to build a whole arsenal of skills. So let's do a quick fire round of the absolute core skills that a student has to master.
First up, history taking. And this is so much more than asking questions. It's the art of listening. Before you can even think about a diagnosis, you have to hear the patient's entire story. This is always the first, most crucial piece of the puzzle. Next, we have the general examination. This is all about observation. It's about training your eye to see everything, from vital signs to nutritional status. You have to gather critical clues with just a single look.
Building on that, we have an absolute pillar of patient safety: sterile practices. Mastering the rituals of scrubbing, gowning, and keeping that sterile field is fundamental. There is absolutely zero, and I mean zero, room for error here. And finally, look, you can have the steadiest hands in the world, but it all means nothing without this: ethics and professionalism. Respecting the patient, getting informed consent, and communicating with compassion. That is every bit as critical as any technical skill you can learn.
Okay, so we've seen the mountain you have to climb, and we've seen the intense training montage. So now, for the final boss battle, how do you actually conquer this thing? Let's talk strategy.
It really boils down to 4 key actions. 1, you have to read the standard textbooks. There are no shortcuts here. You need that deep foundational knowledge. 2, you practice case presentations until you can do them in your sleep, because that's what sharpens your thinking under pressure. 3, revise the frequently asked questions to spot the patterns. And 4, relentlessly, obsessively focus on your hands-on clinical skills. Because in surgery, theory without practice is useless.
And after all that blood, sweat, and probably a lot of tears, what do you get? A license to kill, like some kind of secret agent? Nope. You earn something far more profound. You earn your license to heal. And that comes with a pretty incredible weight of responsibility.
So the big takeaway is this. This entire grueling, insane process is all about building a powerful, unshakable foundation for your future. Because at its heart, surgery is a vital and pretty exciting field that's all about changing people's lives for the better.
You know, facing these exams is truly one of the greatest battles of a doctor's life, which kind of leaves us with one last question to think about. After seeing everything it takes to get through this, do you think great surgeons are made or are they born?